Options to replace a missing front tooth. So are you a soccer player or a hockey player and you're missing a front tooth, or maybe you had a tragic zipline accident or fell down the stairs? The question might be, what can I do to replace this missing front tooth and get confidence and get my smile back? In this video, we're going to break down all the options you have and find the best one that's right for you. Hi, I'm Dr. Brett Langston. I'm a prosthodontist and I'm the Director of Dental Implant and Aesthetic Specialists in Brookhaven, Georgia. And I'm here to help you watch your mouth. So when you're missing a front tooth, you've essentially got 5 things you can do to address that. And I'll kind of go in depth on each one. First one is a dental implant. Second one is a resin bonded bridge. Third one is a conventional dental bridge. Fourth option is a removable partial. And the last option is to do nothing and just rock and roll with missing that front tooth. No treatment is always an option, but something to be concerned about in addition to the aesthetic and kind of the social disadvantage of missing a front tooth is you do need to be worried about teeth shifting and moving to replace that missing tooth. You can also have issues with speech. You can have issues with chewing ability. Very rarely do we recommend doing nothing if you're missing a front tooth. The next option to replace a missing front tooth is a removable option. What that means is basically once you've healed, whether that tooth has been extracted and the site's healed over, or if you've been missing the tooth for a while, is we make you a prosthesis that you take in and out. It basically will replace the missing tooth. It will replace any tissue with a pink acrylic. So when you put the appliance in, you get up in the morning, put the appliance in, you can go all day. You can talk, you can eat, you can sing at church. Nobody's going to know you're missing a tooth. The only disadvantage is that's something you have to take out at night. And I need to reinforce the fact that you do need to remove it at night. The main reason I tell patients that is because the mouth is a very wet environment. So I compare it to if you go to bed with wet socks on your feet, when you wake up in the morning, your feet are going to be pretty nasty. And so if you think about it, the mouth's a very wet environment. So if you have something in there overnight, kind of compressing those tissues, you're going to get infections and the tissue's never going to have a chance to heal. A lot of people actually have removable appliances. Sometimes they're referred to as flippers because you can flip them in and out. But they're very useful, especially in situations where you're worried about losing more teeth, like a hockey player, a rugby player, someone that wants to have the appearance of all the teeth, but is worried about damage from their occupation or a sibling. Shout out. Some of the advantages of a removable appliance are that it's the least expensive treatment option. It's something that we can make very quickly, we can produce, we can get it to you quick. So if replacing that tooth, if time is an issue, a removable appliance, even if it's just a short-term solution, is a great option. The disadvantage of that removable appliance is that unfortunately, yes, you do have to take it out at night. So if that's a concern for you, you can do it in the bathroom, you can be secretive, but you definitely want to take it out and let that tissue breathe and heal overnight. The next treatment option is a dental bridge. Now there are 2 types of bridges. The first one is a resin bonded bridge, which is sometimes referred to as a Maryland bridge. And we use this a lot of times when you have healthy teeth adjacent to that missing tooth. And also we use this a lot in children where we don't want to take away very much tooth structure because we're not sure how they're going to heal and we don't want to damage teeth. Basically what the Maryland bridge or the resin bonded bridge is we do a little bit of reduction on the back side of the teeth next to the missing tooth, just basically enough thickness for us to build a fake tooth with 2 wings on the side. And those 2 wings are actually cemented into place. So when you come to see us, we'll do a little bit of tooth reduction. A lot of times we don't even need to get you numb. That's how minimal that kind of shaving. Think of it as kind of little tiny carving a line in the back of those teeth. We'll do our impression and the lab sends us back this beautiful tooth with these wings on the side. And those wings can either be out of white zirconia or they can be out of typical dental metal, gold, which has a silver appearance. And then when you're there for the delivery, we actually etch the teeth and we bond it into place. So when you leave that day, it is solid, it's in place, it looks and feels like your regular tooth. And pretty much you can eat and chew and function like you did before. The only caveat I would say on that is you don't want to put any force directly on the fake tooth, like a raw carrot, or if you have a really bad habit where you're biting your nails or biting your, ripping open packages. A lot of times we're really just relying on the bond of those wings to hold that fake tooth in place. But it's a great solution, and it's definitely the most minimally invasive solution for something permanent that stays in your mouth. The alternative to a Maryland bridge is your typical fixed dental bridge. And with that, basically, we reduce down the teeth on either side of the missing tooth, and we prepare those for crowns, and then we have a 3-unit piece or more if you're missing more teeth that has the fake tooth and then 2 caps that's all one piece. We put that in and it gives you the appearance of all 3 teeth are there looking normal. Big advantage of fixed bridges is, let's say you're missing that front tooth, but the teeth on either side are either heavily restored, have some decay, have big fillings, have older crowns that you want to replace. By addressing that missing tooth, we can also correct the adjacent teeth. So a lot of times, an implant is a great solution, but if those adjacent teeth need to be addressed at the same time, it's one of those killing, two birds with one stone. We can knock out both problems, give you a beautiful smile, and not have to go down the surgical route. The other advantage of a bridge is it's permanent. We cement that in place, it stays in place. We design them to last a lifetime, and they look and feel like your natural teeth. One of the advantages of a fixed bridge versus an implant is we can get the turnaround time pretty quick. Basically, you have the preparation appointment where we get you nice and numb. We've got a video to talk about this. Click on the link. We get you nice and numb. We prepare the teeth down. We make you a temporary. We make a nice impression. We put the temporary in, so you'll leave that day with the temporary that looks really nice and lets you function and feel like your regular teeth. And then typically it takes the lab about 3 to 4 weeks. We get you back in, we remove the temporary, put the bridge in, make sure you love it, make sure we love it, make sure everybody's happy, and if everybody's good, we'll bond it into place. So you leave that day with your permanent 3 or 4 multiple unit bridge that looks and feels like your natural teeth. With a bridge, there really are no restrictions. You can eat and chew and function, just treat it like your regular teeth. It's definitely very strong. There's a little bit more involved in the hygiene aspect of it because you have your 2 teeth and you've got the fake tooth, so you need to get under there and clean everything to stimulate that tissue. We've got another video coming up that'll kind of highlight some of the details about how not only oral hygiene, but how to clean around a bridge. So you may be asking with a bridge or an implant crown, is it one size fits all? And the answer is definitely not. So everyone has a different shade of teeth. In fact, in the most common tooth shade guide we have, there's up to 16 different shades of tooth, and that's not even counting the bleach shades. And so at each appointment, before we order the crown from the lab, we'll take a custom shade on each patient. So sometimes that means not only diagramming out if the top half of the tooth is a certain color, the bottom half is a kind of a certain color, whether it's in the gray family, whether it's in the yellow family, whether you've bleached the bejesus out of this thing and it's really white if we need to match that. Sometimes we'll have the lab technician come out, the person who's actually making the crown for us, get eyes on your mouth, because every mouth is different and there's lots of little nuances, and so we make sure we get in there and match it, because at the end of the day, we want this fake tooth to blend in and look like your natural teeth. So we've got the capability to make that happen. That's a good question. That's a really good question. The final option for replacing a missing front tooth is a single dental implant crown. This is a great option because it gives us the ability to just address the area that's deficient. We don't have to touch the adjacent teeth. It's a very straightforward surgical procedure where we basically can control not only the depth and where we place the implant, but we can build the tooth so it looks like it's naturally emerging out of the socket, and it'll blend in with your other teeth. So a dental implant for a single tooth, the best way to think of it is kind of a 3-part stack, almost like an ice cream cone with 2 scoops. So you've got the implant, which goes up in the bone, and that's the titanium screw that the bone actually grows around, and that stays in your bone right up to the level of your tissue. And then we've got a custom piece that we put into the implant that screws into place, and it looks kind of like a little miniature tooth. And then on top of that, we've got your permanent ceramic crown that looks like the natural tooth that gets cemented into place. And once that's in place, it stays in your mouth, it doesn't come out, and you can chew, function, and treat it just like your other teeth. So the big advantage of a dental implant is it's the most you're gonna feel like your natural tooth. Probably the biggest disadvantage with implants is that it takes time. It's not a quick fix, it's a process. A lot of times people come in expecting to get their final tooth the day of surgery, and that's just not the way it works. In order to make sure we've got the greatest chance for success, it takes time for the body to heal. So you extract the tooth. Sometimes if you have a deficient bone or the area is not strong enough, we have to put bone in there that day of extraction. And if you put bone in, you have to wait about 3 months for that bone to heal and grow and be ready for the implant. So that's one little phase of waiting. And then we place the implant. And again, once we put the implant in bone, we need to wait another 3 months for that bone to fully grow onto the implant. And once it's done that, then we come in and we can start the process of making the tooth that goes on top. Now, occasionally, if the situation is right, if we've got good bone, we've got a good healthy area, sometimes we can put a temporary crown on top of the implant the day of surgery. But that basically, I just call that a party tooth. It's just designed to look nice. We don't want you touching it. We don't want you chewing on it. But in some situations where everything lines up perfectly, we can do that. And these are all things to discuss with us when you come in for your treatment plan. If you want to learn more about replacing teeth in more detail, click on our video, 4 options you have for missing teeth. I'll see you over there. Until then, I'm Dr. Brett Langston, helping you watch your mouth.